Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about shoulder dystocia. Shoulder dystocia is thankfully a rare but sometimes serious complication of pregnancy. And we'll go over a little bit of what is shoulder dystocia today, and also a few of the things that you can do to help reduce your chance of this thankfully rare problem. So shoulder dystocia is when the shoulder during the delivery process gets entrapped, and dystocia is interference with delivery, and where the shoulder gets trapped under mom's pubic symphysis, the bone right down here. If the baby gets entrapped there, it can have serious consequences to the baby. Some that could cause nerve damage or deformity or problems with the arm. For example, there's something called an Erb's palsy, where there's neurologic damage to the arm. It doesn't function as well. It may not grow as well. Or it could even be life-threatening to the baby or life-threatening to the mother. There are some risk factors for this and some things that you can do to reduce those risk factors. However, it is estimated as many as more than 50% of the time this occurs with no risk factors. Let's go over some of the risk factors. One of them is a large baby. So the larger your baby is, the more chance of this, especially when it gets over 9 pounds. Another risk factor is if you are overweight, so obesity. You can see some of my other videos on helping control your weight or reduce your weight. If you're not pregnant, it's always healthy and better if you can bring your weight down. If you are already overweight, to avoid excessive weight gain during the pregnancy. So anyone, whether they're overweight or not, that has excessive weight gain during pregnancy is someone who is at higher risk for the shoulder dystocia. Also, diabetes of pregnancy is a risk factor, and diabetes of pregnancy is linked to weight and diet and weight gain. So they're all interrelated, but especially diabetes of pregnancy that is poorly controlled, which is why we do lots of extra monitoring and interventions and advise you on your diet and perhaps taking medicines and some exercise to keep your weight in check and to watch the baby to make sure it's not growing excessively. Now, the details of all of this is something that you need to be speaking with your provider about, especially if you have another risk factor, which is a prior shoulder dystocia. So meaning if your baby if you had that problem during your prior delivery, you certainly want to mention that if you have a new doctor, in case they aren't aware of that. It is important to work with your physician if you have more concerns on what you can do to reduce those risks. When this is encountered during the delivery and the baby can get entrapped, there are some measures that can be done to reduce the chance of problem to get the baby to deliver, and your staff should be aware of those on how to handle it, but there's only a certain time limit when you're trying to deliver the baby, where if you're unsuccessful at relieving the shoulder being stuck under the symphysis and delivering the baby, that you might need an emergency C-section. So that's where there's kind of a timing issue involved. Just to reiterate, the incidence of this, various quotes, it's around 1%, could be a little less, a little bit more, is nice and low. But it's important to be working on your overall health, controlling your weight and your diabetes. And if you have some of these risk factors and you want to find out more, then it's a great idea to have a discussion with your provider initially on your visit, or when you're near delivery, like around 36 weeks or in labor and delivery. So I hope you found this information of use. Please leave your comments. Thank you.